So, I'm thrilled to be here with some great news that will ensure that the doctor is in for Twin-Tier residents.
Senator Chuck Schumer brings good news to hospitals in the Twin Tiers. Local hospitals would have lost more than $4 million in federal Medicare payments if not for legislation written into the fiscal cliff deal that passed at the 11th hour. Good evening, I'm Renata Steele.
I'm Scott Cook. Thanks for choosing Twin Tiers tonight in high definition. It is good news for hospitals, patients, and for Schumer because he made a promise during negotiations that he would restore that money.
The funding expired in September, but the fiscal cliff deal restored it retroactively. WENY TV's Tanja Reike's live in the studio to break it down. Tanja.
Scott and Renata, a lot of hospitals in the area don't treat a large number of patients, but a lot of the people they do treat are Medicare patients, so they really rely on the funds coming in through these programs.
We have the third largest rural population in America. You wouldn't think that, would you? But we do.
New York Senator Chuck Schumer is touting his and other senators' efforts to restore money for federal Medicare-dependent programs for rural hospitals.
And so the low-volume program said, and then the Medicare program in addition, we're going to give a little extra payment to smaller volume hospitals so they can give equally excellent health care.
If the programs expired, hospitals would have seen some deep financial difficulties. St. Joseph's in Elmira would have lost $1.69 million, Corning would have lost $804,000, Ira Davenport in Bath $570,000, and St. James Mercy $535,000.
It's huge, and it means that we can continue to provide the quality care that we're used to and we expect, and to purchase equipment and modern technology to continue good care in the region.
Senator Schumer also said the program helps ambulance companies since they often have to travel long distances.
We're having a lot of cutbacks in the Medicare programs these days, and these will counter some of those cutbacks so that we can maintain services and programs that we have in place now.
Cooper says about 2 out of every 5 Arnett-Ogden patients are sponsored by Medicare, and the rate is even higher at St. Joseph's and Ira Davenport.
Arnett Health alone employs more than 3,000 employees in the area. The extension of the programs avoided what could have been a major setback for the community. Live in the studio, Tanja Reike, WENY TV News. Scott?